right. So we'll go ahead and get started, and whoever else is joining, I'll add them into the room. My name is Javeria. Again, I'm the program coordinator. We're joined by Ria, who's our lovely clinical intern here. And she'll be presenting on empowering your voice in a room full of white coats. I'm not going to take up too much time, and I'll let her explain the rest.
All right. Thank you, Javeria. And welcome, everyone, and thank you for being here today. My name is Ria Atwal. I'm a Master of Social Work Welfare student at UCLA, and I'm currently interning at Cancer Support Community and it's been about almost 9 months now. So it's been wonderful to be part of this community, and I'm excited to present today's workshop. So I'd like to talk about moving from feeling overwhelmed by the healthcare system to feeling more empowered to navigate it with confidence. So we're going to discuss how to make your voice heard in medical settings, or what I like to call speaking up in a room full of white coats. Yeah. So I like to start out by just understanding a little bit more about cancer distress. It's important to start by acknowledging that distress is a universal part of the cancer journey. Research actually shows that it affects approximately 40% of all survivors. And at CSC, we look to empower the whole patient through a biopsychosocial lens, which means that we recognize that your needs go beyond just a medical diagnosis to include emotional, financial, and logistical concerns as well. So our goal here today is to help you transition from carrying the individual burden of navigating these systems to using more objective tools that can create a common language between you and your healthcare team. Just a note, we want to make sure that you understand, like, you don't have to navigate this alone. There are several key roles designed to support you. So first being HICAP counselors, who provide free, unbiased Medicare counseling to help you compare plans and review drug costs. Another support system are our patient navigators, who are professionals that can help you overcome individual barriers, such as scheduling your appointments and connecting you to financial or transportation resources. Another great resource listed here are social workers. So they are usually located within your treatment center and can link you to support services, including emotional support and resources beyond the clinic or the hospital that you're visiting. And finally, Cancer Support Community can act as your home for holistic care, as we provide free support groups and educational programs and workshops such as these for you and your friends and family as well. So I'd like to start this community discussion by laying a couple of ground rules. So just to ensure that this is a safe space for everyone before we open up the discussion. So we practice strict confidentiality and mutual respect first and foremost. And this is going to be a non-judgmental environment where we honor what's known as the series of one, meaning your individual story is unique and valid. So there are no dumb questions here, and I also ask that we practice active listening and stay focused on empowering one another through our shared experiences. So I'd like to open up the discussion with this first prompt. And feel free to unmute yourself and jump into the conversation. You can also use the raise hand feature if that works better for you. But I would like to ask everyone, how comfortable do you feel speaking up in a room full of white coats?
Pretty comfortable.
Pretty comfortable?
if they listen to you.
All right.
And can you speak up a little bit more, Ria?
Yes, I can try to project a little bit more. Thank you for
All
letting
right,
me.
thank you.
Yeah.
But I have to say that I typically ask uh, my doctor or whoever's in the room to really focus on what I say and not look at a computer screen.
Mhm.
So I ask them to make time to listen and to answer questions, and then do whatever they have to do on the computer screen.
Yeah, definitely. It can be a great space to ensure that you're meeting your clinicians face to face and having that direct interaction. I think that can be a great way to feel more comfortable with the care that you're receiving. Thank you, Regina. Yeah.
I think I feel pretty comfortable speaking up until I feel invalidated. And then if I feel like I'm not, I think Lisa had mentioned this, like if I feel like I'm not being listened to, I shut down. And so I don't know if I come in with like a list of questions, I can kind of keep going through. But yeah, I typically will shut down and forget what I was even going to say if I feel like
And
I'm
they
not being
say
heard.
they say, didn't I answer that already?
Exactly. Yeah. Yeah.
I agree
Yeah.
with Hannah. You have to basically walk in the door with a full-on list. Every meeting that we went to, I had a full list, and it got to the point where the physician's assistant would grab the list from me and say, "All right, Cynthia, I don't want to have you to ask me the questions. Let's go through what you need." And because that way you kept yourself on track. Because otherwise, you just forget once you get um, disrespected. Of course, that's a way extreme word. Let's not overthink that. Once you get that way, then you're right. You just crawl into your little snail shell and go, okay, well, I guess that wasn't that important after all. So it's the only
Yeah,
way to hold their feet to the
but it's
fire.
important to us.
Yeah.
Yeah. Thank you. Thank you for sharing. Anyone else have any thoughts on this? I wanted to also pose a follow-up. Does it matter the clinician that you're speaking to, how comfortable you are in the situation?
Nah, I could talk to God and I wouldn't care. I mean, it is what it is. It's black and white. We needed to cure his cancer. That was it. It didn't matter who I was talking to. It could be the janitor or it could be the CEO. They all have to hear you.
Yeah, definitely.
I mean, with fairness, dignity, and respect, of course, but
Yeah.
yeah, I didn't hold back.
Anyone else have different experiences with different clinicians, or is it kind of the same for everyone?
I was gonna add, I think I think it also matters how you're speaking to each part of your healthcare team, like your nurse and then a PA and a doctor. I think those all matter because um I've just noticed sometimes in past experiences and just working in the healthcare field that um nurses tend to maybe listen a lot more and absorb kind of what you're saying, and then they can relay that to the doctor too. And sometimes doctors are in a hurry and um, they kind of just want to give you ABC when it's really like, A.1, A.2. So um, I think that's also something too that can be considered. And sometimes it's the opposite. Sometimes a nurse is, not really fully present, and your doctor is more present than they are. So that's also, I guess, something you can
Mhm.
take into consideration.
One of the first things that UCLA Health told us was your doctor is trying to cure the cancer with all means possible. And that's their whole focus. That's why they have patient navigators and other people to help when issues arose. And yeah, I guess my husband and his oncologist were lock stock together with things, so they understood each other very well. But when it got to the point where it got to be, he just wanted, it was his role was to cure the cancer, however it took. And it was like, whoa, 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 back off, buddy. The navigator would step in and find ways to either give me the right words or step in it themselves and make it so that there was a positive connection or more positive connection.
Yeah, definitely. I have a resource later in the slides just on the usefulness of patient navigators and nurse navigators in translating, like you mentioned, Cynthia, between what you establish as your priorities and maybe the common language of other clinicians and using their system as well. So it can be a great way to bridge that gap. Yeah. All right. If no one has anything else, I'll move on to our second discussion prompt. So this can be a little bit sensitive just in sharing, so feel free to share as little or as much as you're comfortable with, but have any of you experienced barriers to care or faced discrimination in the healthcare system?
No.
You really don't want to know.
So this is our next prompt is, how do non-medical expenses like parking or food impact your ability to attend appointments? Does it feel like similarly weighed compared to the logistics of attending appointments? Does it get in the way sometimes? Or do you not notice it at all, maybe?
I would like to say something here.
Yeah, go ahead.
I'm Regina.
Thank-
And for me, right now, it's not the parking and it's not food, it's the gasoline prices. Because even when I want to attend in-person events provided by Cancer Support, I think twice now. Am I really going to drive to Westlake or not? So that makes a difference. I mean, not to the point where I have to worry about tomorrow's hot meal, but it is a budgeting issue. Yes.
Yeah, definitely.
How far away do you live from it?
I'm in Studio City, so I drive, 40 minutes, 35, 40 minutes each way.
Yeah,
Which,
that's
under normal circumstances, before the gas prices hits over $6, I didn't even give it a thought. But now I do think about it. I do consider it. Yes.
This is Hannah, and I think some non-medical, I was going to say something like gas, especially if it's far, and then even just having to take off work. If it's something that's deep in in LA, and it's going to take me an hour to get there, right? And then you're there for a few hours and then an hour to get back. I mean, that could be a half to a full day off of work. So that combined with the gas money of it, I think it can be a barrier to even wanting to go and to me deciding to want to do more stuff online too.
Yes, thank you. Yes, I think that is a huge push for example, for our organization, even post-COVID, where we started to open up a few more things in person as well. a huge push for us to still retain the virtual aspect. So we do have support groups online. We do workshops like this over Zoom for accessibility reasons. And I think that it's a great way to kind of keep our reach to those who are facing different scheduling challenges and the financial burden, as both you, Hannah and Regina, have mentioned, with things like gas prices and time taking off of work. So yeah.
And none of those things, oh, this is something, none of those things like parking or food or gas are reimbursable at the time of occurrence. However, they are reimbursable through your medical, drug, and dental Schedule A of your tax return. I do taxes at the Global Center here in Thousand Oaks for seniors. We did 3,900 tax returns this year. And do plenty of taxes. And a lot of people keep track of anything related to that. And there is a space to be able to take off mileage, parking, and then there's, those abilities to be deductible off your income tax return. I realize that's an annual event, but it would be nice if some of these things were reimbursable from insurance on a per occurrence basis, because parking in Santa Monica and downtown is just outrageous. And I'm sure it's a lot more now.
Yeah, definitely. Thank you, Cynthia. That was actually a great pointer to the annual tax returns on things like that. So yeah, great advice. I think Manoj, do you have your hand up?
Yes, this is Manoj, twice cancer patient survivor. So at our support group this past Monday, they talked about the Cancer Society, not our center, but Cancer Society has a program. If anybody needs a ride, there are volunteers to take you to and from the doctor appointments and treatment centers. Also, I was at the library today, Thousand Oaks Library, and I saw Nadia. And I noticed that they have like for people who need food, I didn't get the information, but there is an organization in every city for people they provide food for them if they need it. Yeah, I just wanted to say that. And I heard that, speaking about gasoline, that Canada, from now until their Labor Day, I believe in September, they don't charge the gasoline tax for the people. So, they can save some money. Unfortunately, yeah, it's affecting everybody worldwide. Yeah.
Yeah. Thank you, Manoj. Yes, that was great information as well, and great to hear about the reimbursement. Thank you. Does anyone else have any experience with resources in terms of mitigating these additional expenses outside of your treatment costs? All right. Then we'll move to our next prompt. So, what makes your experiences with providers positive or run smoothly? I think we already touched on this a little bit in terms of wanting your providers to be able to hear you out fully and be engaged in your conversations together. Anyone have any other positive experiences that they'd like to share?
Maybe having a family member with you
Hmm.
or a very good friend that can have an extra pair of ears.
Definitely.
That's helped me.
This is Alyssa speaking.
Yeah, I'm sorry.
No worries, no worries. But yes, having a trusted support person can be very helpful in catching extra information you might have missed, and just having that emotional support there is really helpful. Yeah.
This is Carol. My sister goes with me to all my doctor appointments. And so I felt like, we had two people listening to try to cover and remember everything important that was said. But then I found out that I could use my phone to record my appointments, whether they were phone appointments or phone calls or actual in-person appointments. I now record all my appointments and transcribe most of them, because I want to know exactly what did he say about this issue. The transcription takes a very long time, but I'm so glad that I found out that I could record. I don't know if anyone else has had any experience with making recordings of their doctor visits. Or not appealing, evidently.
No, I was going to say, would it be nice? It'd be nice if could you share how you learned how to do that and what you do? It might be helpful to a couple of us.
Well, on my iPhone, there's a little thing called voice memos. And you just click on that and push the red button and it starts recording.
Perfect. Thank you.
If it's a phone call on my iPhone, there's a little button in the upper left-hand corner. And when you hit that, it says out loud to you and the person on the other end of the phone call, you are now being recorded. It makes an announcement.
And I think that's similar to being on Zoom. I don't know if anyone else has heard, but it'll say recording in progress during our meeting and then recording stopped. So, yeah. And this might not capture the full amount that a complete recording would capture, but taking in a notebook is always a great way to record what's being said. And you can always ask your provider to repeat themselves or slow down. You are entitled to knowing all the information that you're being provided with and fully understanding what's being said in an appointment. So, yeah.
Hi, can I ask a question? This is Anna Strickland. Regarding the recording, I actually, someone told me that we're not supposed to do that. And personally, I mean, I used to do it and then I stopped because someone told me that it's like, I don't want to say not legal, but not, I don't know. And I would like to hear from the moderator what the situation is with recording a medical appointment.
Yeah. Yes. Hi, Manager.
Sorry?
Yes, this is the manager. Since 15 years, you're both absolutely right. And some physicians don't like to be recorded. They give you time to write whatever your question is and you receive the answer. But places that I've gone to this date, I ask. Some they say, oh, absolutely, it's all right. Some they say, no, it's I don't feel right about it, you know? It's just asking. Either it's yes or no. Thank you.
Okay, so it's not a question of legality. It's a question of just being polite and asking is what you're saying.
Yes.
Okay, great. Thank you.
Yes.
You're welcome.
Especially from the patient perspective, there's less regulation because it would be you in charge of your own information in that setting. So If you decide to disclose your own medical history or your own appointment information, that liability is on you as an individual. And it doesn't follow the same rules as from the clinician's perspective, which they do need to get explicit permission to use things like AI tools in your session or recording as well.
Oh, they need to ask permission because I noticed
Yeah.
one of my doctors was recording me and didn't ask me if he could. So I was a little taken back by that.
Yeah, it should be somewhere in some document that you've signed that you are giving express permission to be recorded.
Okay, thank you.
And also, Ria, I noticed that, at UCLA Health and Kaiser, whatever you talk with your doctor while they're typing, once you're checking out, they give you, like a printout of your visit. Everything's there. If you read it immediately, you read what you said, what they said. It's all there. I love that, Even in my chart, in my chart, I can see that.
It's actually, they always give me a printout, but all the questions I ask and their answers are never in my chart.
Are you UCLA Health?
Yes.
Oh, amazing. Yeah, some doctors are good at it. I have no issue. I don't need to remember everything. And I always keep those for my record. I have a folder. So by the date, I can go back. They have it anyway, but for my personal things, it's there. Like I said, okay, what did this doctor said about this medication and all that? Yeah.
Okay. Yeah. My experiences, they give me a summary of what they told me, but not necessarily answers to my questions. I have never had that repeated back to me in the notes.
Oh, I see.
Yeah.
Yeah, it's just my doctors. Yeah, they say, I read even on my chart online that patient asked this and this was.
Who's your doctor? I'd love to know.
Yeah.
We have
with my doctor because I had breast cancer and I started using black seeds.
Yes.
And I was not feeling foggy brain anymore. And I shared that with my support group. And I said, I've been using it for a month and a half and I can, it's so clear, I don't need to write things down. And then our facilitator said, definitely check with your doctor, your oncologist, and also your primary doctor. So I checked and my oncologist kind of scratched it. It goes, I don't think that, it's a concern for your breast cancer, but my gynecologist said, absolutely no, you don't use black seeds. So that was on my chart. I read it, that patient mentioned that she uses black seed and I informed her not to use it because I was HER2 positive. Yeah.
Okay.
Thank you, Manoj. Yeah, and just for everyone as information, depending on the recording tools or AI tools that your provider uses, it'll create a different summary for your visit. So you can ask at any point in time if you'd like a full recording of your entire medical record, and they should be able to provide whatever is in their system to you.
Right.
Oh, great. Thank you.
Yeah. And Patty, you have your hand raised.
Oh, I was just gonna, my name is Patty, and I was just gonna reiterate, because I have UCLA and I have 13 doctors, and what makes my experience with my doctors better is to keep track. I keep a book, but I do the after visit summary.
Right.
And I add it to my book, and this helps me so much because I can't keep track. But I do go back into my chart. And I know exactly what you're saying. You could look in your note, the doctor's notes in the My Chart.
Mm-hmm.
That's where it's separate from the after visit summary. And I also print that out if I need it for, like, let's say Social Security or something. But just sometimes you can find it in the My Chart, the notes. Just wanted to give that little tip.
Yeah, thank you, Patty. Yes, and for those of you that don't have UCLA Health as well, a lot of insurance companies and medical providers have their own online portal. So if you can learn that system really well, it can be a great way to get those summaries, as you mentioned, but also get appointment reminders, access to your medication list, and all of that. So,
Right.
yeah. Right. Anything else in terms of our question here, in terms of any positive experiences with providers?
Yeah, I just one time right after pandemic, 6, 7 months after, I saw my heart doctor, and I saw when he was talking to me, I was sitting in front of him. He was shaking his leg, like being nervous, like he's in a hurry. And I said, Doctor, don't do that, because later on when you age, you might get Parkinson's because it's nerves, you're just shaking your leg. And he goes, oh, thank you for reminding me. It just, because of pandemic, we're so stressed out, very stressed out. And I said, Doctor, you're in a great facility. Go for a walk. Instead of you put the stress on your body, go for a walk. So I found out that the physicians, also I have a lot of people in my family who are physicians, that they are under stress. It's both ways. We're sick. They see so many, patients. So anytime I visit them in their office and I say, hi, doctor, and once they arrive, and first thing I say, how was your day? So they kind of calm down and they say, oh, busy, thanks for asking. It just, they've been busy, overwhelmed. That's what I want to share. Yeah. It just, a lot of them are retiring. And the other ones that they need to work, they're reluctant. They're getting sick themselves. Yeah, I just wanted to share that. Thank you.
Yeah, thank you. Yes, it's always a great way to start any discussion, by sharing exactly where you are in that place and time, and then also having that mutual respect is incredibly important. So,
Right.
yeah, thank you.
You're welcome.
All right, we'll move on to our last question. And this is a little bit general, but what is your relationship with self-advocacy, and how do you feel before, during, and after your appointments? So kind of thinking about those times and if they fluctuate at all. Yeah.
Elisa here. I don't feel bashful about speaking up in an appointment unless the provider puts me down a bit.
Mhm.
There are things of concern to me that they may not appreciate.
Yeah.
And then, of course, I get a summary on the portal. But everything is so computerized now that it's, well, at my age, it's a little difficult to deal with, but I'm learning.
Yeah,
With
definitely.
the assistance of my grown-up children and grandchildren.
Yeah. Do you feel that maybe after your appointments is a little bit harder than just kind of decoding what happened during the appointment?
No, but if I forget something, my daughter will remember it, and because she takes notes on her phone as the appointment's going on.
Yeah, that's wonderful.
So, telephone calls, though, are hard to get through to the entities.
That makes sense. Yeah.
Yeah, but you just have to be persistent.
Does anyone else have experience maybe with different emotions coming up before appointments, during or after?
I'm glad when the appointment's over.
Some relief there, maybe. Anyone else?
Yeah, hi. I'd like to jump in on this. This is Anna again.
Yeah.
I do a lot of, okay, so I am actually in my previous life as a scientist, I actually worked on breast cancer diagnosis, and that's what I wound up getting. So I know a lot about the science and the medicine, so that I could have a pretty high level discussion with my doctors. And I always prepare a lot of questions, detailed questions, because basically I'm not asking basic questions. I usually wind up asking pretty, questions that surprise them. But what I have found, and I'm finding this even with nursing, like the nurse practitioners and et cetera, I have to agree with what the other woman said about they're very busy and they're very stressed. And I'm finding that during the appointment, I do a lot of prep work before I walk in. So I'm usually optimistic that I'm going to get questions answered. During the appointment and after the appointment, I am invariably upset and disappointed because they don't listen anymore to what you are actually asking or saying.
Good
I
point.
I had an appointment with a new oncologist the other day because I think I'm changing oncologists, and she's very, very good. But what I found is that I was trying to get to the point of my question, but she kept cutting me off with what she thinks I was about to say. And we wound up talking over each other and me never really being able to get my point across. And she just kept talking over me and talking over me. And this seems to be happening a lot, no matter who I'm seeing. And I'm a little, I don't know what to do about it. Like, even just before the reason I was late coming in is because I was talking to one of the scheduling nurses at my surgeon's office, and I had to actually stop her because she was not hearing at all what I wanted, the issues around the appointment and what I was making the appointment for. And finally, I said to her, XYZ name, I know you're really busy, but can you just listen, because I don't think you're hearing me.
Mm.
But why do I, but it was so frustrating that this phone call went on for 10 minutes because she wasn't listening to me. And I don't know what to do in these situations. It's like I feel disrespected. I feel minimized. And I'm seeing it all over healthcare now, because I've been in healthcare for 40 years working. So I know what it used to be like. It's nothing like that anymore. So I just wanted to throw that out there.
Yeah, thank you for sharing. I'm so sorry that you've been having this experience, and it does sound incredibly frustrating. Before I jump in, does anyone have reactions to that, similar experiences maybe?
It
Well,
all
yeah.
depends who you get on the phone at the call center
Yeah.
and how understanding they are. Sometimes I get an answer quickly, sometimes not.
Yeah.
But
And I've noticed this across other avenues and other professions, because I had to talk to the receptionist at my accountant's office the other day. I asked her a question and she answered it. It wasn't what I needed to know. I give her total credit for answering the question that I asked. However, the next level was, okay, that doesn't fit your box. You need to go do this. Didn't happen. So, whether we're talking to medical professionals, legal professionals, tax professionals, whoever. I mean, even my plumber the other day, I was like, dude, you're not hearing me. My toilet is clogged. Did you hear that part? Oh, okay. It was really, I think everybody has just gotten so short with bandwidth. Anytime you pick up the phone, it's made me a lot more empathetic to people going through this cancer journey for the last 8 years. I was always very empathetic, and I'm way more empathetic now to whatever anybody needs to have done, or how can I help?
Patty, you have your hand raised.
Yes, this is Patty. I agree with everyone. Because I have so many doctors, I have the same issue. And sometimes I feel like, did they really hear me? And I'm thinking about it and it upsets me. So I've actually I've changed doctors many times if I felt that they were not listening to me. I've done that and asked for another specialist, or I will portal them and say, hi, I forgot to ask this, or these are my questions, and I will portal them and put it in writing. Some of them will answer me because I've been with them for so long, everybody's exactly right. That's the whole thing. Even two doctors have actually told me that they're stressed out. They're so busy. I've actually had my cardiologist tell me that, and my endocrinologist. So I try to be very patient, but at the same time, I would just want to make sure that they're looking at, they're not ignoring something. So I agree with everyone.
Yeah,
I
thank
won't
you.
even begin to tell you how many doctors I went through
Mm-hmm.
that didn't listen to what I was actually, my symptoms. Long story, but anyway, I finally got to the right place and the treatment's successful. So you have to be very persistent and get to the right person.
Yeah, definitely. I think pulling from everyone's input right now, I think having that empathy is really important, but also not disrespecting your own boundaries is huge. And if that means finding a person that is right for you and you can build a long-lasting relationship with, I think that's incredibly important. So, yeah. And then I think also, as Patty mentioned, finding the way that works for you in terms of communication. If something in person isn't working, switching to online messaging through your portal or contacting new providers over phone. Video visits are really popular right now. That's a great way to do that. And then if you do have those questions, sometimes a great way to slow someone down is by handing them the written list of questions. So that way they can take the time to read, digest, and it kind of pulls them out of maybe whatever hectic environment they might have been coming from, or the stress that you both are experiencing outside of the appointment session. Yeah. Any other additions to the conversation? All right. I'd like to thank everyone for sharing. It's really helpful to hear from each other and navigate this process as a community. We can learn a lot from listening to other experiences and getting all those little tips and tricks. And then you can go out and try them on your own. And it's okay to take time with that process as well and be kind to yourself through that process. All right. So I'd like to switch gears a little bit. I have some tools here. You will be sent a packet with a couple of different worksheets, given what we've spoken about today, some extra resources. But yeah, I'd like to start with the personal support care plan. So this is a way to help unburden the process of self-advocacy. So we can use objective tools like this to self-identify exactly where you need support. This could be clearly stating your needs, as you all mentioned. So you want to speak to a specific staff person or specific department and really be able to vocalize that. Maybe it's that you need the accommodation of having written information, such as those after visit summaries in a printout handed to you. And it can also be that you need help with insurance or financial concerns. And you're able to ask this directly to your medical provider, as well as your insurance company. So you can kind of work on both ends and get the best support that you need. So I've added this as part of a worksheet along with a few other resources. And it should be in the chat as well. So if anyone is interested in that right now, you can walk through that with me as I go through the next few slides. So here's some general tips for self-advocacy. Before the appointment, you can write down your top 3 concerns. And one other thing that's really helpful is bringing a support person and an updated list of all your medications and supplements. That can be a great way to make sure that you're up to date with everything. You can update your provider, but also really having that person to rely on in terms of taking extra notes, being another set of ears, or just even for the emotional support of very stressful, sometimes stressful appointments. And then during the appointment, you can be sure to ask about your treatment options and who to contact if symptoms change at all. I think that follow-up plan is really important to establish while you're sitting with your clinician directly. And another thing, a great technique is to verbalize exactly what you heard. So repeating back to the doctor what you understood, and any questions to clear up any confusion. And then remember, it's always okay to ask for clarification or even get a second opinion as well. So organizing your care, you can use your patient portal. Different healthcare systems, as I mentioned, will have different portals, or some will have just direct messaging systems where you can either email your doctor. I've seen sometimes you could just text your provider directly. So it really depends on what level of insurance and provider that you have. But another thing to remember is to never underestimate the power of the list. And we've really gone over this session. So I'm glad that a lot of you are already using this tool, but bringing a written list to every visit and even practicing a script, so to speak, beforehand, if you feel nervous or maybe you're unsure about some of the questions you want to ask. You can do this with a trusted person in your life to not only get that practice, but also some preliminary feedback. Maybe they have other ideas about different questions to ask or things to remember for your appointment. And then finally, always establishing that clear follow-up plan before leaving the office. So who will I contact if I need help? It might be for your treatment plan specifically, as I mentioned. It might be for follow-up with insurance purposes. It could be contacting or connecting with that social worker or patient navigator as well. Yeah. Are there any questions on any of these before I move on?
Well, you said that we were going to receive a packet.
Yes, so there is a PDF in the chat for this Zoom. And then after this workshop, everyone that has registered will receive an email with the same PDF.
Okay, so it's a PDF coming via email. Okay, I don't know how to get to the chat. So,
Right.
but as long as it's going to come in an email, that's fine. Thank you.
Yeah, of course, of course. Any other questions?
Thank you.
All right. And then just closing. So by using these tools, we'll hopefully help you move from being more of a passive consumer of healthcare to an active partner in your care. And I see that many of you are already taking that very active role in your own care and the care of your loved ones as well. So if you need any further help, one great resource specifically for insurance is HICAP, Ventura County, and the number and website is listed here for any insurance related questions. And then always feel free to contact us at Cancer Support Community. We are a great tool and a great pit stop on the way to a lot of different resources and can help you navigate that. And I want to leave everyone with a quote from our a cancer advocate, Ellen Stovall. With communication comes understanding. with understanding, fear diminishes. In the absence of fear, hope emerges.
True.
All right. Thank you, everyone.
Thank you. Thank you very much.
Thank you, Ria.
Thank you, Ria.
Um,
Have a good weekend, everybody. Good health.
Thank you.
thank
Bye.
you too.